My name is Jeremiah Bashford. Today I'll be performing a wound change assessment on my patient. So as you see my patient down here already, I've already assessed the two client identifiers. I've obtained his consent, I've ensured his privacy, and now I've already went to the side to ensure the side railing is up for his safety. The bed is already up to working position, and the next thing that I'm going to do is perform hand hygiene before I assess his wound. Put on clean gloves. Okay. So the next thing that I'm now going to do is I'm going to open his wound, his old dressing. So I'm just going to open his dressing. So I see that there is a sanguineous drainage over here. Assessing for redness, I do see some redness, ecchymosis. I do see they're proximate, they're not approximate to each other. I want to slowly gentle palpate the sides. So once that's done, I'm just going to take this here, put it in my garbage receptacle, and I'm going to get my transfer sheet here. And I'm going to get my kidney basin over here and I'll start my dressing. Okay, now that's done. I'm going to take off my gloves. So, okay, I'm going to perform hand hygiene. So now I'm just going to adjust my sterile field to working height. With my hands, I'm going to open the 1-inch border. Like that, literally like that. Yeah, it's pretty easy and we're filming ourselves. Okay. So the next thing that I'm going to do now is add my supplies into my dressing tray. So I'm just going to banana peel all of them. That's someone else's. Don't take that. Excuse me. Okay. Next thing I'm going to do is open this. This. Next thing that I'm going to do is add my solution. So just going to lip it. Okay. So once that's done, just going to, before I go sterile, I'm just going to assess everything, making sure that I'm good. I have my cotton tip wood applicator here, which I would be doing last. So I'm just, before I go sterile, I'm just going to take my forceps here, and I'm just going to take my old packet. I'm going to remove this, and I'm going to discard this with my forceps. Okay, taking my old cotton tip applicator with the bottom side being non-sterile and the top being sterile. Just gonna measure length, width, depth, check for any tunneling, any undermining. Yes, and then I'm gonna take my measurements here. As I've taken my measurements, I'm gonna discard this. We don't need this anymore. So now that's done. The next thing now I'm going to do is now go sterile. So just going to take my gloves, my sterile gloves, for hand hygiene. Okay, with my dominant hand, just take this, pinch it. So my hands are now sterile. So the next thing that I'm not going to do now is with my syringe, I'm going to take up to 30 millimeters. And with my angio catheter, just going to put this in here. Okay. With a high pressure, I'm going to go into the zigzag motion. Once. Okay. Now that's done. I'm going to put this in my sterile field. Normally I wouldn't discard that yet because it's a sharp object. So with my forceps now, I'm going to gently wipe with the 4x4. I'm just going to start from the cleanest to the dirtiest. Discard. Okay, discard. Okay, take another one. We're just gonna go down in the middle from the cleanest to the dirtiest. Discard. Okay, so after that's done, the next thing that we're going to do is we're going to pack it. So with my 4x4, sorry, before that, I'm just going to take my ribbon and I'm just going to rub it around my thing before we go into that step, sorry. So with that rub on my forceps, I'm just going to gently unravel it. Gently, and pack it lightly, not too much. And then with my forceps, gently take a 4x4. Pack it. Okay, And then I'm just going to take a cotton pad over here. Take this down in the middle. I'm going to now take off my gloves and I'm going to put on the tape. So just so now we're done sterility. So I'm just going to take a tape over here. I'm just going to take the sides here. Now that's done. I'm going to discard all my items and I'm just going to reposition my patient and I'm going to perform hand hygiene. And then after I'm just going to put the bed back to its normal position. And then I'm just going to make sure my sharp object goes into the sharp bin. So that is everything.